Welcome to this medwireNews podcast, where we will be talking to Sangeeta Sule, Associate Professor of Pediatric Rheumatology at Johns Hopkins University in the USA, about the transition from pediatric to adult care for patients with juvenile arthritis. First of all, Sangeeta, could you outline the key differences between pediatric and adult care for these patients?
The main differences between care for children and adults is that for children, care often involves the whole family. So the parents or the caretakers are involved with helping the child administer medicines, understand the disease, get back and forth from appointments, whereas in the adult world, the care is centered on the patient themselves. The patient is really the one expected to be in charge of their medications and their visits. So the main difference between pediatric and adult care in arthritis is that the pediatric world involves a team, whereas the adult world is patient-centric. And as a provider, our goal is to transition the pediatric team to the adult patient-focused care as they age into the adult world.
And how does this transition from pediatric to adult care typically work?
So ideally, the transition care from pediatric to the adult world starts early. It's really important that the groundwork be laid early, such as 11, 12 years old, even before puberty, that laying the groundwork in the patient and family's mind that they will need a plan to transition to the adult world, and adult services are different. Each young person should have an individualized transition plan, so outlining their medicines, who they follow up with, whether that's physicians, physical therapy, occupational therapy, whatever complex care is necessary for them. Ideally, this should be written down so that both the patient and the family or caretakers and the physician are aware of the goals of transition. And the healthcare team should give appropriate training in adolescent and young adult rheumatic diseases so that the patient understands why they're doing the things they're doing. As the patient gets older, involving the adult caretaker, the doctor on the adult side, is important, and often transitioning involves a few visits with the pediatric rheumatologist as well as an adult rheumatologist so that the patient and the caretakers get experience with how the adult services work. So the goal is that the patient transfers to adult care seamlessly with no loss in visits or confusion or change in medications.
Could you tell me what the main challenges are that are associated with this transition?
The main challenges are that it's time-intensive, both for the patient, the caretaker, and the providers. Ideally, for the providers, as the child is aging, a medical summary including past complications from disease, past medications, should be updated. For the parent and child, it's a challenge to keep track of what they've done in the past, what's expected of them in the future, to keep the doctor appointments. And I think for the parents and caretakers in particular, it can be very challenging to let go and let the child and the patient, and now young adult, take more responsibility for their care. And this could even start at home with allowing the patient to be responsible for their medications, such as laying the medications out in a pill box, and that them being the one responsible for taking the medications regularly is an easy way to start. But it can be a challenge for parents who've been on top of keeping the child in line and getting them to and from appointments and being the one involved in their care to transition and let the patient get independent.
So are there any steps being taken to facilitate this transition process? For example, are there any programs in place?
Yes, they're both in Europe and in the United States. There are wonderful resources available through the American College of Rheumatology in the U.S., the Arthritis Foundation, Lupus Foundation, all the disease-specific foundations. And in Europe, the European guidelines developed for transition of young people from pediatric to adult rheumatology care, announced through the European Congress of Rheumatology in 2016. And both of these, both the U.S. and European guidelines, provide resources for patients, parents, and providers. Provide written checklists for providers, for parents, provide an outline of what we should aim for transitioning. What the programs are excellent at doing are making sure that we stay on task, that the transition from the pediatric to the adult care happens in a very organized fashion, and the resources available on these websites can help foster that.
How successful are these transition programs?
When they're followed, they are very successful. I think when the guidelines are followed, multiple studies have noted that this results in seamless care, transitioning from pediatric to adult world. What other studies have shown, though, is that when these guidelines aren't followed, so if there's not a clear path to transition from the pediatric to the adult world, and even perhaps some overlap in appointments between pediatric and adult rheumatology, as many as 40% of children may drop out of care. So there's a real risk that these patients will flare again with their disease or be lost to medical care and present down the road with severe complications, all due to lack of transition. For example, not having an appointment with an adult rheumatologist, not knowing how to fill their medicines or how to give their medicines can lead to these lapses in care. But when these guidelines are successfully implemented in clinics, they have been shown to be very successful.
In your opinion, are there any ways in which the transition process can be improved?
I think all of us are busy in clinics. It's hard to take that extra time to go over these steps for transition in clinic when all of us are pressed for time and clinic appointments are getting shorter and shorter. So I think having a dedicated clinic space to do this. So, for example, in some reports of successful transition clinics, it's called a transition clinic, and that's dedicated for their teenage patients, where they have multidisciplinary support. So the provider meets with them, the nurse meets with them, social worker, all in the effort of making sure that the care is seamless to the adult world. I think that model of making transition as important a part of the medical care as the medicines themselves or the disease themselves is how we can improve transition. And same goes for the adult side, knowing that a pediatric patient is transitioning to the adult world, letting, if needed, the parents be involved in the care initially, and then slowly transitioning the parents out of the care so the patient has more autonomy may be needed initially, because if you remember, in the pediatric world, the parents may have been involved, very involved with the care. So somehow easing that burden for the parents and letting the patient take control, I think will be important for the adult care as well. So I think there are many pathways for successful transition. I think just being aware that this is an issue is important for all of us so that these patients can wind up in the adult world being well taken care of and lead happy and healthy lives.
Are there any techniques you would recommend to ensure the correct information is communicated in the transition process?
So the main things that have been tested are the written pathways, so that the pediatric rheumatologist focuses on the past medical history, the current medical history, the current medications, and provides that in a detailed summary to the adult rheumatologist, and perhaps even reaching out with a verbal phone conversation to the adult rheumatologist. When those things are done, studies have shown that the adult rheumatologist then feels more comfortable with the pediatric disease. Often these diseases are rare and they're not something that the adult rheumatologist sees very often. So spending that time talking on the phone has been shown to ease the adult rheumatologist's concern for treating these now young adults who are appearing in their clinic, and has been shown to result in better quality of care, so better satisfaction, patient satisfaction, and provider satisfaction. So even in this day and age of electronic records and everything being available on the computer, it's still important to close that loop and make sure that people reaching out by a phone call and making sure that people are aware of what the patient's needs are.
So, we've heard that it's really important to start the transition from paediatric to adult care early for patients with juvenile arthritis, and that there are resources available to guide rheumatologists through the transition phase. Sangeeta emphasised that transition plans should be in place to make sure that young people, as well as their guardians and their healthcare providers, are aware of any potential issues and know what to expect when they move into adult care. Thank you very much to Sangeeta for sharing her thoughts on the transition from paediatric to adult care. You can take a look at toolkits to assist with this transition on the ACR website, and the EULAR recommendations were published in the Annals of the Rheumatic Diseases in 2016.